Levalbuterol, also known as Xopenex Concentrate Vial, is used to prevent and treat wheezing and shortness of breath caused by breathing problems such as asthma and chronic obstructive pulmonary disease. It is a quick-relief drug that belongs to a class of drugs known as bronchodilators. Levalbuterol works by relaxing the muscles around the airways, helping them to open up and allowing you to breathe more easily. By controlling the symptoms of breathing problems, it can decrease the time lost from work or school. The recommended dosage and timing for taking this medication should be determined by a healthcare professional. Before using the Xopenex Concentrate Vial for nebulizer, you should read the patient information leaflet provided by your pharmacist. This medication is used with a nebulizer, which is a special machine that changes the solution into a fine mist for you to inhale. It's important to learn how to prepare the solution and use the nebulizer properly. If a child is using this medication, they may need help from a parent or responsible adult. If you have any questions, make sure to ask your doctor, pharmacist, or respiratory therapist. The medication should be clear and colorless, so be sure to check it visually for any particles or discoloration before use. If you see any, do not use the liquid. Using the nebulizer, you'll inhale the medication into your lungs as directed by your doctor, usually 3 times a day. Each treatment typically takes about 5 to 15 minutes. It's important to use this medication only through a nebulizer and not to swallow or inject the solution. Also, do not mix it with other medicines in the nebulizer. To prevent infections, be sure to clean the nebulizer and mouthpiece/face mask according to the manufacturer's directions. You should use this medication regularly to get the most benefit from it, so try to use it at the same times each day. The dosage will be based on your medical condition, age, and response to treatment, so don't increase your dose or use this drug more often than prescribed without your doctor's approval. Using too much of this medication can increase your risk of serious side effects. It's also important to learn which of your inhalers/medications you should use every day, controller drugs, and which you should use if your breathing suddenly worsens, quick relief drugs. Make sure to ask your doctor ahead of time what you should do if you experience new or worsening symptoms. And, be sure to tell your doctor if your symptoms do not improve or if they worsen. Some common side effects of Xopenex Concentrate Vial for nebulizer may include nervousness, dizziness, shaking, trouble sleeping, headache, nausea, dry mouth, increased coughing, or runny nose. If any of these effects persist or worsen, notify your doctor or pharmacist promptly. It's important to remember that this medication has been prescribed because your doctor has determined that the benefit to you is greater than the risk of side effects. Many people using this medication do not experience serious side effects. This medication may also raise your blood pressure, so it's important to regularly check your blood pressure and inform your doctor if the results are high. Contact your doctor immediately if you experience any serious side effects, such as fast or pounding heartbeat. Seek medical help right away if you experience very serious side effects, including chest pain, irregular heartbeat, rapid breathing, or confusion. In rare cases, this medication has caused severe, sudden worsening of breathing problems or asthma. If you experience sudden wheezing, seek medical help immediately. Although very rare, a serious allergic reaction to this drug is possible. Get medical help right away if you notice any symptoms of a serious allergic reaction, such as rash, itching or swelling of the face, tongue, or throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed, contact your doctor or pharmacist. Remember to consult your doctor for medical advice about side effects and to report any side effects to the appropriate authority in your country. Let your doctor know if you have any allergies before using Xopenex Concentrate Vial for nebulizer, and discuss your medical history, especially if you have diabetes, heart problems, high blood pressure, kidney disease, or seizures. This medication may cause dizziness, so be cautious when using alcohol or marijuana. It's important to avoid driving or operating machinery until you know how this drug affects you. If you're planning to have surgery, inform your doctor about all the medications and supplements you're taking. If you're pregnant or breastfeeding, talk to your doctor about the risks and benefits of using this medication. It's important to be aware of potential drug interactions when using Xopenex Concentrate Vial for nebulizer. This medication may change how other medications work or increase the risk of serious side effects. Make sure to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. It's crucial to not start, stop, or change the dosage of any medicines without your doctor's approval. Additionally, since levalbuterol is very similar to albuterol, it's advised not to use inhaled medications containing albuterol while using levalbuterol. Be sure to follow these guidelines to ensure the safe and effective use of Xopenex Concentrate Vial for Nebulizer. If someone has taken too much Xopenex Concentrate Vial for Nebulizer and is experiencing severe symptoms like passing out or difficulty breathing, it is crucial to call for emergency help. In the U.S., you can call the local Poison Control Center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. Symptoms of an overdose may include chest pain, fast or irregular heartbeat, headache, shaking, nervousness, weakness, severe dizziness, and seizures. It is important to seek immediate medical attention if any of these symptoms occur. It's important not to share this medication with others. Your doctor may perform lab and/or medical tests, such as blood pressure, heart rate, and EKG, while you are using this medication. Be sure to keep all medical and lab appointments and consult your doctor for more details. To help manage your breathing problems, it's important to avoid allergens and irritants that can worsen symptoms, such as smoke, pollen, pet dander, dust, or molds. Using a peak flow meter daily can help you monitor your breathing, and it's important to promptly report any worsening breathing problems, such as readings in the yellow or red range, or increased use of quick-relief inhalers. Since the flu virus can worsen breathing problems, it's a good idea to ask your doctor or pharmacist if you should have a flu shot every year. If you forget a dose, just use it when you remember. If it's close to the time for your next dose, then just skip the one you missed. Take your next dose at the usual time. Do not take double dose to make up for the missed one. When storing Xopenex Concentrate Vial for Nebulizer, keep the vials in the foil pouch at room temperature, away from light and heat. Do not store in the bathroom. Once the foil pouch is opened, use the medication immediately. Discard any vials if the solution is discolored. Remember to keep all medications out of reach of children and pets. Do not flush medications down the toilet or pour them into a drain unless instructed to do so. Properly discard this product and it is expired or no longer needed. It's best to consult your pharmacist or local waste disposal company for the proper disposal method. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.